My name is Byron Vaughn, and I'm a physician. I'm a gastroenterologist at the University of Minnesota, and I work with Dr. Koritz. I'm here to talk today about how achieving cures together has helped my research. So I study ulcerative colitis. Ulcerative colitis is a condition where the immune system of your body attacks your colon and the gut bacteria in your colon. We don't know exactly what causes or triggers the inflammation, but the end result is inflammation in the colon. And this can be a life-debilitating disease leading to bloody diarrhea, weight loss, increasing the risk of colon cancer, and having people ultimately end up having their colon taken out, which is a really big surgery and comes with its own set of complications. Unfortunately, right now, the only way that we have to manage ulcerative colitis is to dial down the immune system. These therapies do not actually treat the underlying cause. We're treating the secondary inflammation, but we're not actually getting at the cause. There's a lot of consequences to the therapies too, and those can include injection site reactions, infusion reactions, infections, and even in some cases causing cancer. So ideally, these are not the best therapies that we have. What's exciting about using gut bacteria is the shift away from immune suppression and the shift towards changing the stimulus for inflammation. We think that if we can change the stimulus for the inflammation, we can just leave the immune system alone and let the body heal on its own. And that's ultimately one of our goals. There have been a couple of studies already that have looked at using fecal microbiota transplants, or FMTs, for ulcerative colitis. And in general, they've all shown a trend to success. When all four of these trials were pooled together, there's about a 20% reduction in symptoms. Now, 20% may not sound great to you, but that's actually as good as all of our biologics. So interestingly enough, after 8 weeks, this therapy seems to be as good in very early studies as some of our mainstay biologic medications that we use for ulcerative colitis. Our study is a little different in a couple ways. First, we're the first study to actually look at pills. The other studies have used FMT material either in repeated colonoscopies or enemas, which can be very challenging to take over and over. So our study is looking at a new way of administering these healthy gut bacteria to hopefully treat and mitigate this disease. Second, ours is one of the first studies that's actually looking at a rationally selected set of bacteria. Specifically, we have a theory that potentially too much hydrogen sulfide gas is bad. And so if we can put in bacteria into someone with ulcerative colitis that has a very low potential to create hydrogen sulfide, that will end up doing better than just any old bacteria that may or may not be healthy. So we have a rationally selected set of bacteria in the form of pills. We could not do any of this research without the support from Achieving Cures Together. And that is not an understatement. While we are actively getting funding from foundations and government agencies, sometimes this research is hard for grant agencies to fund because it is so exploratory and it is on the cusp. And so the only way to generate data to take this to the next step is by using philanthropy, is by funding. And so this absolutely would not be possible to do without donations from patients and loved ones and everyone who has supported our therapy. So thank you for those who have donated, because we could not do this without you. We are really excited to push this field forward, specifically with ulcerative colitis. Our first study is looking at what we call induction of remission for ulcerative colitis. We hope that we can use this to get more funding and look at larger trials that really look at how effective this can be in both improving clinical symptoms and treating the inflammation on colonoscopy. And that is the hard goal for ulcerative colitis, is healing the colon on the inside. Our current study will give us a suggestion of that based on symptoms and gut bacteria, but it's not going to be enough to get some of these what we call hard outcomes, such as endoscopic healing. We hope to look at that in the future. And more than that, we hope to look at how using this therapy could help people to maintain remission over months to years. There's a lot of other exciting ways that we envision studying how microbiota therapeutics can play into ulcerative colitis, including potentially stopping other medications and only using gut bacteria as therapy, changing your risk of colon cancer, and more. So I really think this is just the tip of the iceberg in terms of using microbiota therapeutics in ulcerative colitis. We also have a lot of hopes to look at this in Crohn's disease in the future, and we'll already have some very preliminary data looking at just the gut bacteria changes in people who have undergone surgery for Crohn's. So there's a lot more work to be done, and we're really excited to keep pushing it forward.